Jasmine, tell me how you got into becoming a dental hygienist therapist.
Right. Hi. Basically, I went into this course because I was a pharmaceutical chemist before. I got my degree at Queen Mary's, and I did the masters at City University. That was my information systems technology master. So, very unconventionally, I decided I wanted to change careers, and I phoned up King's while they were clearing, and they had a space for dental hygiene therapy. I wanted to do dentistry, but when I got in for dental hygiene therapy, I realised how important it is and how we focus on prevention, and I've loved it ever since.
Okay. Yeah, in talking to you, it seemed that the whole prevention of diseases and infections was kind of quite a big, well, satisfied you a lot in the job. I mean, is that right?
Absolutely.
Yeah.
We prevent things like fillings, like gum disease and gingivitis, so we're stopping all that bacteria proliferating and causing all the problems. So yeah, regular visits to the hygienist obviously would help a lot of people out there.
Okay. I guess one of your issues is persuading people to come because...
That's right, we're not as scary as... I mean, once they come through the door and we're able to make them feel comfortable, I think that's really important, building that rapport with the patient.
Okay. What are some of the things that you find challenging, or, you know, if one's looking at what's difficult or complex in the job, you know, decisions, you know, can you give us some insight into that?
Absolutely. Well, with some patients, you do find that they can be very, very open to suggestion and motivated and etc. Some patients are a little less. They've gone through the whole rigmarole with dentists, they've seen other hygienists, they've never been motivated and they haven't. So getting them in there and really inspiring them to change their routine can sometimes be hard. Thankfully, I haven't come across too many that I haven't been able to influence. Pat myself on the back.
Yeah.
But in general, you will find that out of 10, 5 of them initially will not want to listen to you, or might not look at you when you're showing them how to brush their teeth and that kind of thing, because they think they know it all. And you have to break that barrier and tell them, well, actually, I'm here to show you you haven't been doing it well, that's why you've got inflamed gums, for example.
Okay. Now, you have an interesting role because you're, in addition to being a hygienist, you're also a therapist.
Yeah.
Tell us briefly, because I've never known about this,
yeah.
Tell us briefly what a dental
Absolutely.
therapist does. Yeah.
Well, dental therapists, basically, we can do fillings using any material, temporary fillings, permanent fillings, on adults and children. For children, we can do extractions, we do stainless steel crowns, I do pulpotomies. So it's a much wider...
Pulpotomy?
Pulpotomy is basically like a root canal for an adult, but obviously for the child it's a lot smaller because we're dealing with primary teeth. So yeah, it's very, very rewarding, and you do get to practice that. In the practice, if you're lucky. There aren't a lot of therapists out there, they're mainly hygienists though, because at the moment the dentists do the majority of the fillings, etc. And we're mainly used for hygiene, but as I teach at King's, I also have a paediatrics department there, a little section, so I have kids that come to me and I do their fillings and extractions and all the rest of them. It's very rewarding.
Cool.